Good afternoon, everyone, and welcome to the first Fall Prevention Month webinar hosted by the Sunnybrook Center for Injury Prevention and the Sunnybrook Fall Prevention Committee. My name is Brandy Tannenbaum, and I am the Injury Prevention Coordinator in the Torrey Trauma Program at the Center for Injury Prevention. November is Fall Prevention Month in Canada, and it's a month dedicated to raising awareness about preventable fall-related injuries across the lifespan. Fall injuries are particularly relevant in young children and older adults. All Canadians share a role in preventing falls. Why do we need a whole month dedicated to this injury mechanism? It's because falls are the leading cause of injury-related hospitalizations among Canadian older adults, and approximately 20 to 30% of older adults fall each year. Falls are also the leading cause of hospital admissions from injuries for children ages 0 to 14 years. Today's webinar will introduce some points to consider on your health journey. If you have fallen yourself, know or care for someone who has, or would like to prevent a fall from happening in the first place. Our program today is designed specifically for the older adult and older adult caregivers. Next slide, please. So this event is being recorded, and we will share a link to all of those who are registered for the event today. We're using Zoom, as you know, and so we have webinar features that enable you to ask questions. So you can use the chat function or the Q&A function at the bottom of your screen. Before we get going, we're going to do a land acknowledgement. To acknowledge the land that we're meeting on is the traditional territory of many nations, including, for those of us in what we now call Toronto, the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and the Haudenosaunee, and the Huron-Wendat nations. Toronto is covered by Treaty 13 with the Mississaugas of the Credit, and this territory is also subject to the Dish with One Spoon Treaty. The idea is that we all eat out of the dish, all of us that share this territory and its resources with only one spoon. That means we have to share the responsibility of ensuring the dish is never empty, that there is something left for the next people. Importantly, there are no forks and knives at the table, representing that we must keep the peace. I'd also like to take a moment to acknowledge those of the Black diaspora who were removed from their lands and communities and brought to this country involuntarily and subjected to oppressive structures and systems, causing centuries of trauma, which have deeply impacted Black people and communities in Canada today. These are particularly relevant reflections as we come together today to ensure that we're here for all of the populations we serve when it matters most, including those communities with worse access to appropriate care and disproportionately worse health outcomes as a result. Let us be mindful of these inequities and strive to remove them. So, as previously mentioned, fall-related injuries are a significant healthcare concern. Let's take a look at our local numbers to better understand what we see at Sunnybrook and in the trauma program as we look ahead at prevention and consider how we might be able to reduce these numbers in the future. So this first slide that we're going to look at helps us to see that we treat approximately 2,000 people in the Torrey Trauma Program each year. And I want to clarify that traumatic injury is a significant public health issue, and it costs Canadians almost $30 billion every single year. So here at Sunnybrook, at Canada's largest trauma center, we treat approximately 2,000 people each year. And you can see on this slide that our major mechanisms of injury include falls, motor vehicle collisions, penetrating violent injuries, and other types of injuries. Across the last 5 years, we've treated over 2,600 traumatic and severe fall-related injuries. And these are different than the injuries that you would see and that would be treated in the emergency departments in terms of their severity. And here you can also start to see the breakdown by sex, in that more males are treated for fall injuries than females. On our next slide, there we go. We can see again in the last 5 years that we've had an upward trend in fall injuries that dropped in the early part of the pandemic, but then began to rise again in 2021. And again, here we see a stark contrast between males and females' injury experience. The last chart we're going to look at, because data isn't always the most fun thing to look at, is the breakdown over the years by sex and age. So this is a chart. And the key point here, when we're looking at where the arrows are showing a jump in trauma admissions in the 55 to 64 age category. We see just a little bit ahead of that the numbers are starting to creep up in that younger group at 45 to 54 year age band. But then it does take a sharp increase thereafter. And if we look again at the male to female ratio, it's quite interesting. It's not until we look at the 81 plus age band that we start to see females catch up to males in terms of injury rates. So that's a little bit about the data. And I have the pleasure of working in the Center for Injury Prevention that aims to reduce intentional and unintentional serious and fatal injuries through collaboration, advocacy, research, and education. It's in this space that we work with others, like those on today's webinar, to promote prevention as the best and least expensive form of healthcare. So let's put on our prevention mindsets and get going with today's program. Before we get to our panel discussion, we have a brief but fulsome presentation from one of Canada's preeminent fall prevention leaders. It is my pleasure to introduce Marguerite Oberle Thomas. Marguerite is a senior who has worked as a consultant liaison for Loop Fall Prevention Community of Practice for the past 14 years. Marguerite has worked in injury prevention since 1996, and she spent many years as a public health nurse in both the Grey Bruce and Huron counties, working in injury prevention and as a psychiatric nurse in Owen Sound. Marguerite has published numerous articles related to fall prevention and caregiving, as she was also a caregiver for her late husband and her mother. So Marguerite, please take it away.
Thank you so much, Brandy, and I'm absolutely delighted to be here. This is the 8th annual Fall Prevention Month promotion, and obviously, fall prevention is one of my very favorite topics. Could we have the next slide, please? That's just background information, and going to the next one. I don't know what you think about this chap here, but he is the one who keeps falling down. And whenever someone falls, you can always look back and say, what happened before that? Why did that fall occur? Now you can see that this chap here, both could benefit from tying up his shoelaces, but he's also a tad out of shape, don't you think? Next slide, please. So this is the slide that shows multiple risk factors. And my fellow presenters are going to go into more detail on some of these, but I'll start with talking about nutrition. In order to have good nutrition, we need good oral health. And oral health for older adults is something I advocate so strongly for, because it's not something that's recognized always as being as valuable as it is. We need good oral health to have the ability to chew the kinds of food that we need to keep us strong and healthy. To keep our strength up, that we can exercise and we can keep strong muscles and bones. What happens with building bones is that stops in our 20s. We've built up all we're ever going to have. We start to lose it. We build up our muscle mass until our 50s, and then we start to lose it. But with good nutrition and exercise, we can help to keep ourselves stronger and to avoid falls. And more than just falls is the injuries from falls. We can have health issues like increased blood pressure, chronic health diseases. We can have issues with our vision and hearing that all need our attention. There's many things here, including the bathroom, which is where many of the falls in the home happen with injuries. The surfaces in the bathroom are hard, and there's a lot that we can do to help with that. There's other topics here like medication and home safety features that are going to be covered. So let's move on to the next one. Big thing right now, wherever we are, it's winter. We're going to be having snow up north of Toronto. We do already have a lot of snow. So what can you do for safe winter walking? Well, before you ever head out, assess your weather and look at your route and know the paths where there can be ice underneath. Tell people where you're going, have a nice drink of water so you don't become dehydrated, dress in layers. But the big message is to do the penguin walk if you are anywhere near where you think it could be slippery or uneven. And you'll see our little fat penguin there. You bend slightly, walk flat-footed, point your feet out slightly like a penguin. You notice this is also how toddlers walk. You keep the center of gravity over your feet as much as possible. Big thing to watch where you are stepping. If you're going with somebody and you're talking, you're looking at that person, you can miss something. Short shuffle-like steps are important, and please keep your arms at your side, not at your pockets. If your hands are in your pockets and you go to fall, there's nothing to stop your fall. Concentrate on keeping your balance. And my big, big, big message is to go very slowly, always. And that concentrating and going slowly are perhaps the biggest fall prevention messages that we can give you. Next slide, please. So one of the big things that we really appreciate is knowing which boots are best. Footwear is very, very important. And we have a website called Rate My Treads, which can help you to learn more about safer footwear, especially your boots. But also just to talk about shoes for a minute, they should fit well and be firm. Flip-flops and loose slippers are not your friends. And you know those nice knit slippers that people make? Those are strictly foot warmers. They really are not proper footwear at all. Next slide, please. So this is it's difficult to read, and I'm not going to go into it in a lot of detail because this is on the Fall Prevention Month website, and we are going to share that link with you. But are you at risk of falling? This is the Staying Independent checklist, and it asks you the various questions, and then it gives you steps to lower your risk of falling. One of the big things right off the top is, have you fallen in the last 6 months? Because one of the greatest predictors of a future fall, that is a previous fall. Next slide, please. So stay independent and prevent falls. Know that many falls are preventable. As I said earlier, it's often more than one risk factor, but keeping aware and going slowly, those things all help. We can take actions. There's lots of actions we can take. And knowing your own individual risk factors and having a plan for things that you may need to change, and talking to your healthcare provider, and you will hear more about that. So where can you get more information? Next slide. The Fall Prevention Month website, and if you just put in Fall Prevention Month, you can get it as well. So thank you for my part. Moving along.
Wonderful. Thank you, Marguerite. If anyone has questions for Marguerite or any of our panelists going forward, please use the Q&A function at the bottom of your screen. And we are also adding all of the links that are mentioned throughout today's session in the chat box as well, so you can grab those. We will also email the list of resources and websites to you, along with the link for the recording of today's session. So now it is my distinct pleasure to introduce our panel and our facilitator. I wonder if we've got this, yeah, everyone's got their cameras on. That's great. Okay, so first up is Chris Van Loan. Chris graduated from the Leslie Dan Faculty of Pharmacy at the University of Toronto and went on to complete a hospital pharmacy residency at Mount Sinai Hospital. He is a board-certified geriatrics pharmacist with more than 20 years of experience in acute care. He is based at the Veterans Center of Sunnybrook Health Sciences Center and working as a pharmacy clinical coordinator with a focus on palliative care, geriatrics, and general internal medicine. His scholarly interests include medication optimization in frail older persons, interprofessional education, and prevention and management of delirium. Also joining us is Emily Brewer. Emily is a physiotherapist at Sunnybrook Health Sciences Center, working primarily in general internal medicine. She also has experience working in Sunnybrook's neurovascular unit, cardiology unit, and the cardiovascular intensive care unit. In addition, she works casually at Providence Healthcare in Scarborough, providing coverage on the geriatric and medical rehabilitation floors. Nadine Narain is an occupational therapist at Sunnybrook Health Sciences Center working in the emergency department. She is part of an interdisciplinary team called ED1 that works to facilitate safe and supportive transitions to the community for patients presenting to the emergency department in order to reduce the length of stay, divert admissions, and reduce emergency department revisit rates. She also works casually at the Holland Orthopedic and Arthritic site, where she supports patients before and after orthopedic surgeries. Additionally, Nadine works as a community occupational therapist, providing care to clients in their homes who are palliative, structurally vulnerable, and or have complex comorbidities. Of course, you've already met Marguerite. So rounding up our panel, we have Siobhan Donaghy. Siobhan is the professional practice leader for occupational therapy at St. John's Rehabilitation Program and co-chair of the Sunnybrook Falls Prevention Committee. In her role, she supports best practice education, quality improvement, and practice-based research with a strong interest in patient engagement and interprofessional collaboration. Siobhan is also a lecturer and fieldwork instructor at the University of Toronto in the, I can never say, Timotry Faculty of Medicine. I should have practiced that one. The Department of Occupational Science and Occupational Therapy. So I'm going to now turn it over to Siobhan to lead our panel discussion. Thank you.
It is a tongue twister. No worries there, Brandy. Thanks so much for those introductions and for highlighting the nice breadth of experience and different professional perspectives that we'll be able to share today as we launch into our panel discussion. And it fits quite nicely after Marguerite's presentation, and also yours, Brandy, around some of the why. Why are we even here talking about this topic today, and what are some of the things that should be top of mind, and hopefully will help to answer some of the questions that are on the top of your mind as we go through our panel and seek some of their input. So I thought we might start, because I know that Marguerite mentioned about medications as one of the risk factors, right? So she mentioned that medications sometimes can create risks in themselves, the ones that we take, and they can create issues with dizziness and balance and so forth. So I thought we would start off with Chris, and as our pharmacist, if you could, speak to us a little bit about how might medications increase our risk for a fall.
Thanks, Siobhan. People take medications for a variety of reasons, and Marguerite on her slide showed there's lots of indications or disease states that people might take medications for, such as for sleep disorders, to prevent high blood pressure or manage high blood pressure, for pain, for sleep disorders, anxiety, et cetera, et cetera. But, we tend to focus on medications in older adults because certain medications increase the risk of falls in this vulnerable population, especially because it can cause injuries that sometimes require hospitalization, as Brandy showed in her data slide. Now, harmful side effects of medications may cause certain things, such as concentration problems or thinking problems, balance issues, drowsiness, dizziness, or may cause a sudden drop or lowering of blood pressure that also can increase falls. And so from a healthcare perspective and a clinical assessment perspective, it's always important to focus or examine medications, especially in older persons, as the many medications that they are prescribed for valid indications may be significant risk for falls. And so we think about how medications are common causes of increased falls in older adults. They also may be modifiable risk factors. And that's an important thing to do, that it's not just that you have to be on a medication for life and that's it. It's always a collaboration between the patient and their healthcare providers on what it is with their medications, what outcomes they have, and what they want to achieve, but as well as balancing the risks, such as falls. And the other issue is that medication-based risks for falls may be missed by busy care providers and family doctors. Older adults and families and caregivers can help by being proactive in this area, by keeping an up-to-date medication list of all your prescription as well as your non-prescription or over-the-counter medications and supplements that you take.
Thanks very much, Chris. That's a great overview of some of the things that we need to be mindful of, especially when we're discussing our health with our primary care providers, with our pharmacists, when we go to pick up our medications. You mentioned sort of that communication that's so key in understanding the patient that you're working with. I'm going to now maybe sort of turn to Marguerite and then say, you know, based on all of that, how would you know as a client, as a member of the community, how would I know if I'm at risk of falling?
One of the greatest risk factors, of course, is if you have already fallen, if you find yourself getting into any place where you might have a slip or a potential to fall. And there's so many things that if you feel that you ever get dizzy, if you ever have any weakness, basically know yourself and know if you have as much strength as you need to break a fall as well. And we do have that independent checklist to look at.
Thanks. That's great, Marguerite. And I think that will actually be a very helpful checklist. I see it's already been posted in the chat for people to refer to. So you mentioned strength as one of the issues that might be something that would put you at risk. And I know that was in your puzzle diagram at the beginning. So I thought we might turn now to Emily as our physiotherapist. And maybe Emily, are you able to kind of tell us a little bit about how would I know if I needed to see a physio to help prevent a fall?
Yeah. So, as physiotherapists, we're healthcare providers that look a lot at how someone is getting around, so how they're mobilizing. We look at their strength and their balance, and we really want to, help build strength, help build balance, help people stay as independent as possible in their day-to-day life and how they're getting around. So from a fall prevention standpoint, there might be, a few different things you should consider, and especially if you're noticing changes in your balance, or you're having moments where you lose your balance, and if you're not sure, have you noticed that, when you're walking around, maybe you're reaching out for the wall for support, or you're reaching for furniture. Maybe your family member has noticed and said to you, oh, you look a bit weaker today, or are you moving around okay? Or have you thought, oh, maybe it would be good if I used a cane or a walker, or maybe I am noticing some weakness in my legs, or I'm feeling a bit shakier when I get up and walk around. The other thing is fear of falling. That can be a big predictor of having a future fall. So maybe you're noticing that you're a bit more cautious and worried. And as Marguerite mentioned, with the weather changing, it is slippery out there, and there is an increased risk of falls if your balance is not as good as it once was. So, if you are noticing some of those changes, or maybe some of the things I've described sort of sound like you, it might not be a bad idea to look into seeing a physiotherapist. We know that good strength and good balance can help prevent a fall, and physiotherapists are very good at sort of assessing your strength and your balance, and maybe setting you up for an exercise program, or encouraging you to join a fall prevention program where you can get exercises and learn more about how to prevent a fall. And the other thing is, we know falls are preventable. We don't want them to happen, but sometimes they do happen, and getting up from a fall is something that a physiotherapist can help practice with you. There are certain ways to make it as easy as possible to get up after a fall. So that's another thing. If you want to really be prepared in case it does happen, it's something sort of a physiotherapist can work with you at. And my one last point is, Marguerite was great at saying, if you've fallen before, you are at an increased risk. So that might be something else to consider. If you have had a fall before, maybe look into seeing a physiotherapist and seeing if you can try and prevent it from happening again.
Those are some great tips, Emily. Thank you. And you referenced people moving around, walking around, and I suspect many of these falls happen in their homes. So I thought it might be helpful now to refer to Nadine, our occupational therapist on the panel, and get your perspectives, Nadine, on what someone might do to help set up their home for success, to make sure that they've reduced that risk for a fall in the first place.
Yeah, thank you for that question. So you're right. Many falls do occur at home where we spend most of our time and often move around without thinking about our safety. So there are many changes that can be done in your home to prevent falls and to ensure safety. So as an occupational therapist working in the community, when I go into the home, I assess the physical environment to see what are the risks, what are the things that have caused a client to fall, caused someone to fall, or what could potentially lead to a fall. So there are many changes that can be done in your home to prevent falls and to ensure your safety. These can include keep walkways clear, remove obstacles and secure electrical cords, ensure walkways are well lit so that you can see where you're going, consider using night lights, secure rugs and mats, using non-slip mat, especially in the bathroom, reorganizing the home environment to reduce clutter and increase space to navigate around the home when completing daily activities. That's very important for falls prevention. And consider home safety equipment. So, for example, grab bars in the bathroom, shower chair, a reacher, or what's commonly termed as a grabber for dressing or picking up items, and having a falls emergency alarm. So if you've had a fall once, like Marguerite alluded to, there's a good chance that you may have a high risk of falling again. So avoiding doing certain things or using certain equipment that will prevent you from placing yourself at risk for falls. So as a community OT, I would educate my clients about these strategies. These are very common recommendations that I give. And I often assist them with acquiring equipment or providing strategies or recommendations or ideas on how to reorganize the home.
Those are great tips. Thanks, Nadine. And I think what you've done is you've provided both yourself and Emily have provided some practical examples from your perspectives as to how we can help to prevent a fall in our home and in our communities. I'm going to turn back now to Chris to say, from your perspective, if I want to prevent a fall and I'm thinking about the medications that I'm taking, and maybe some of them are the ones that you've indicated that potentially could increase my risk, what should I be aware of then while I'm taking those medications?
Yeah, thanks for that question. So, it's interesting. A lot of people, young and old, but especially older adults, report actually not knowing that medications can increase their falls risk. But they are willing to discuss it and make changes with the healthcare provider to reduce their risk. And so I would recommend that, if you are a person who has fallen or care for someone who has fallen, you should book an appointment with your healthcare provider to review your medications and see if some of them may increase your risk of falls. So identification of those risk factors is really key. And, as a pharmacist that specializes in the care of older adults, we have to sort of take into account the complex relationships, between all your chronic conditions, your medications, your nutritional intake, and other variables. But we work on a healthcare team, and so we can influence a lot of the decision making in all aspects of medication management. And so we also provide counseling tips and information to patients and families. We can provide information and recommendations to physicians or prescribers, and review medication regimens of those patients. And so when it comes to managing medications, a thorough medication review is very important for older adults who are at risk of falls. Making a list of all your prescription and non-prescription medications, or bringing them to a healthcare appointment is really, really valuable. The other thing that you can do, and sometimes your list of medications can be quite long and it's hard to keep track of everything, is you can actually book an appointment for free with your community pharmacist to get and review your list of medications. In Ontario, we have a provincially funded service called MedsCheck. And so it's free for all Ontarians with a valid OHIP card, and they can book an appointment with their pharmacy, and they can get a list of all their medications, both prescription and non-prescription. And they can use that list to bring it to their healthcare provider at appointments for review. to see if any of those side effects or maybe drug-drug interactions may be increasing one's risks of falls. And so the other thing is that with that information, your healthcare provider, to help decrease your risk of falls, may change some of your medications or decrease some of your medications. And this is called deprescribing. And if you've had a fall in the past or care for someone again who has fallen, ask your healthcare provider if deprescribing is right for you and a part of your care plan. The key thing, though, is you should not stop any medications without talking to your doctor, nurse, or pharmacist.
Thanks, Chris. I appreciate you talking about the MedCheck program. I think that's really an important tip for all of us to remember, that just because we're prescribed something doesn't mean we have to remain on it forever. We need to have those conversations with our care providers and really take advantage of some of these nice free tools that you're mentioning, and take out and access them, take advantage of them. Okay. And also, if there's a website, Chris, that you wanted to share with us, that would be great. We can let everyone know what the website is. That would be helpful as a resource. So just building on that, we've now heard from a pharmacy perspective, from an occupational therapy perspective, and a physiotherapy perspective, some of the tips and strategies that are often discussed with clients and patients to help prevent a fall. I'm interested to hear from you, Marguerite. What do you feel is the best thing that someone like I or any one of us should consider in helping to prevent a fall in the first place?
Thank you so much. First of all, I'd like to go back to what Nadine was saying about having some kind of an alarm system, whether it's a wristwatch or whether it's something that you would wear around your neck. At the end of the presentation here, we're going to be showing slides with resources, and those resources will all be part of what everybody who's registered will be getting. One of the things is a radio interview that we did live on rehearsed with CJAD in Montreal, and a very, very delightful colleague of mine talks about her fall and how her alarm system actually saved her life. It really can be very life-saving. The other thing, for those of us who have overprotective children, and I count myself in that classification, they feel a whole lot better when we have these things. And it's true, because if somebody falls, and especially in the winter, you fall outside and maybe you can't get up, maybe you've hurt yourself, or maybe you're people like me who have 2 prosthetic knees, and getting up is not easy. But if you have an alarm system, there are people who can be called to do that. But there are so many risk factors, and on the other side of that is that there are so many things that we can do. Now, the new participants here, they've only met me today, so they don't know that I have some really special skills. I'm very skilled. I can go to a gas station the day before the prices go down and fill up. I do that all the time. The capacity to buy gas when it costs the most is wonderful. My other skill is that I managed to fall upstairs this summer. I had dear friends that I was delivering muffins to. I like to bake anytime there's a death in the family or whatever. And I'm going up these stairs carrying muffins. There is no railing there, but I'm hurrying because I want to deliver them there. And I tripped on the top step, which was not at a proper level. The stairs were not attached to the porch, so they had sunk down somewhat. And it was just, I should have looked, I should have gone slower, but I managed to fall. And if you've ever hit your elbow at your knee, or your knee at that one point where it's so exquisite, it brings tears to your eyes, that's what happened. Now, it wasn't a long-term injury. I did heal from it, but I chatted with my friends. And I also have another set of friends who have very, very poor stairs. And I said, you know, when a sweet little old lady like me comes to visit you, I need to have stairs that I can walk up properly. I need a railing. You take a lady with a smaller hand. If I got on that stair and I started to slip, I need to be able to put my hand around that railing and grip it to stop my fall. A big, chunky wooden railing just doesn't cut it for me. And for children, you know, and somebody with a bigger hand can still use that smaller railing very well. So there are things that we can do with ourselves personally. There's a lot of things we can do with our environment, both in the house and outside and in public places. And I do want to say that was in April, and both of my friends are now installing new stairs. So big, big thing. Speak up whenever you see an environmental hazard. Speak up. And my friends are still my friends, even though I asked them to correct the error of their ways.
What a wonderful example you've shared with us, Marguerite. You're really building on what Nadine was mentioning earlier about, you know, setting up your environment for success. What I really like about that story is that you acted, right? You showed that it doesn't, you don't have to rely on the occupational therapist to come to your home to say that you need to, you know, set up your stairs differently, or you need to put different equipment in your bathrooms. It helps to have those professional opinions, but we all play a role in just looking around and speaking up when we see something that might be a risk. So just being mindful and advocating for our safety and that of everyone else. So thank you for sharing that example. That was a really good one. I can agree that actually over the last couple of years in my community, what I noticed is that a lot of people in my neighborhood started to put up railings on their front steps. And I thought it was sort of curious that everyone was putting them up within a span of 2 or 3 months. And when I asked about it, I learned that it was actually the Postal Service that made it mandatory that everyone had a railing, that there was a railing going up if they had to go, if the mail service delivery person needed to go up a flight of steps to deliver the mail. And I thought, what a great initiative that they're proactively looking at that and making sure that everyone has a safe access to and from the front door of that person's home. So you just reinforced that example in my mind. Thank you for that.
I was particularly proud. The one family, the one partner thought that it was not attractive to put a railing on that particular style of stairs, but he got outvoted. And in the other family, they were talking about what it would cost, and then what would it cost if somebody actually tripped on your stairs and there was a lawsuit, or to cause your friend personal injury and suffering.
Yeah, it's so important to think about safety first, right? Safety first.
Thank you.
Yeah. Thanks, Marguerite. And, you know, you talked a lot about daily activities. You talked a lot about, you know, how we can prevent falls in our day-to-day, everyday activities, such as going to visit a friend and to deliver some muffins. Lots of activities where we potentially are at risk of falling. And so how can we prevent that? Because we know that prevention is key. So I'm going to go back to you, Nadine, and get some thoughts from you. I know you talked a lot about how to set up our environments for success. Is there anything else you wanted to add in terms of, you know, what we can do in our everyday activities to help prevent a fall?
Yeah, so when I talk to my clients about falls and they have insight in terms of their risk for falls and what their limitations are, I would often start out with saying they're the expert in themselves and they know how they're feeling. And I always encourage them to keep that in mind and to always be aware of how they're feeling. So like what Emily said, there could be balance issues, it could be weakness. So it's always important to be aware of the way they move around in the home environment or even in the community. So I'm sorry, there's the police car outside. So to avoid rushing, move slowly when getting up or turning. And if there is the concern around weakness or depleted energy, it's important for them to pace themselves, break tasks into smaller parts, and alternate activities with periods of rest. If they are in the home doing a task and they require climbing, I would recommend asking for help instead of climbing on stools or ladders. So stay grounded. Keep frequently items close, including a telephone or a false alarm. And in terms of more of the daily activities in the home, sit down when putting on clothes or taking off clothes. So if there is a concern around balance, at least they're doing it safely from a sitting position.
Those are great tips. Thanks so much. And I mean, you've referenced balance a few times there as well. So I'm going to turn back to Emily and get your thoughts, Emily, on what would those general tips be for people to stay strong and maintain their balance?
Um, I think the biggest thing is trying to stay as sort of physically active as you can. And sometimes when we think about physical activity, we think about a specific exercise program, like doing 10 squats or going to the gym and using some of the machines. And it really doesn't need to be that complicated, right? Even a 5-minute walk is going to do wonders for keeping you mobile, helping to maintain that strength and that balance. Because if you don't use it, you lose it, right? So even those little things add up over time. And the other thing is to kind of consider all the things that you do in your day as well that also keep you physically active. So even if it's in the home, maybe it's you're going down the stairs to do laundry in your basement. Or you have dogs and you take the dogs out for a walk. That counts as physical activity as well. And you want to do your best, I would say, to stay, as physically active as you can, because even a little bit goes a long way. And the other thing I would say is if you are noticing changes in your balance, so, some of those things that I talked about previously, maybe you're noticing that your legs feel a bit weaker, or you're feeling a bit more shaky or unsteady on your feet. I would say don't ignore it. Like listen to your body, as Nadine says, we know our bodies best. If you're noticing those changes, I would think, try and see what you can do sooner rather than later. So seek out help sooner, whether it's talking to your family doctor about it or doing a medication check with the pharmacist or going to a physiotherapist to work on your strength and your balance. If you're noticing these things, you want to really try and prevent a fall. So, to kind of sum it up, I would say, if you notice something, do something about it sooner rather than waiting for maybe to get weaker and then really have a fall. And do what you can in your day-to-day life, and the little things really do add up.
Wonderful. Those are great tips. And there's a couple more questions I wanted to pose, and they're sort of age-related questions that I have for everyone. So maybe I'll start with you, Nadine, but if others want to jump in, they can add. I have aging parents. I have an aging mother, and some of the tips that were shared earlier about making sure that people don't have scatter rugs around their home and so forth. That's a difficult conversation for me to have with my mother. She likes them. She finds them pretty on the floor, and she likes the patterns. And she also, I think, finds that they provide a bit of comfort under her feet when she's on the tile in the kitchen. So she has these mats, and so I'm asking her to be obviously very mindful of where and when they're used. And we've been negotiating this for a number of years now. I'm just wondering, maybe I'll start with you, Nadine, but others can jump in. What tips do you have for someone like myself how do we approach the subject of fall prevention with an aging parent? Any thoughts or tips that you have or that anyone else has?
Yeah, so I'm in the same boat as you. I also have aging parents, and many aging parents value their independence and may be sensitive when discussing falls, as this may be an indicator to them that they may need to make changes that they are not necessarily ready for. They may be fearful of having to move out of their homes or having to remove a favorite item like a rug that you mentioned, especially after a fall that they have sustained. And so from my experience going into homes and meeting with clients who have already had falls, the first thing that comes up in conversation is, I don't want to move out of my home. I want to stay here. I know I've had a fall, but I want to stay in my home. And then the topic comes up around home modification. So it is important. What I would say to children of aging parents is it's important to approach a topic in a respectful and kind way. So you can explore different aspects of their daily living to identify key indicators for falls risks. For example, you can look objectively at things like, are they eating regularly, staying hydrated, well rested? Are they taking their medications as prescribed? Are they using mobility aids as recommended? So you can start out by having them lead the conversation on how they're feeling and determine if they have insight on what the risks for falls are. And you can work with them to explore options to increase safety in the home. So, for example, if there is a rug that's not securely in place, instead of removing it entirely, and I call this a client-centered approach, instead of removing it entirely, is there something that we can do to make it safer with it being there? Can we tape around the edges? Can we put a non-grip material under so that it doesn't slide? And so you can also talk to them about having someone come into the home. So sometimes parents would probably feel better having a professional come in and talk to them about what are the recommendations and what are the strategies that they should follow so that they can remain safe and independent in the home. And so, in addition to that, providing visits and wellness checks are also important to identify any concerns that may be placing aging parents at falls risk. And also reviewing with them what strategies to do in case of a fall. So ensuring that they know how to get up from a fall. So you want to be proactive in terms of, if this happens, what can you do to avoid further injury? Additionally, children of aging parents can also ensure that they have regular eye and ear exam. That's very important. So that these are also risk factors that could put them at risk for falls. So that would be my input in terms of how it can be addressed with aging parents.
That's great. Thanks. And are any other thoughts from anyone else on the panel about that? Any other tips that you have around those types of conversations? I think you just have to unmute yourself, Marguerite. Yeah.
I would have to say, as an old gal and aging parent, the thing that motivates me is I love where I live. I intend to live well, stay well, be well as long as possible. So doing the things that need to be done are important. And when I had my knee replacement, I actually scored quite high on the frailty scale temporarily, because I was really quite dependent on other people to help me meet my needs. And you need to know when you're frail what you need to think about, and you don't want to stay like that if you can avoid being like that. So avoiding that fall is really important. And I would say for people in my category of older parent is to go with the independent. You know that your parent wants to live life to the fullest. I just wanted to add something else, Siobhan, that I didn't manage to cover when I was talking about safe winter walking. And that is covered somewhat with what Nadine was saying about our vision, especially in the winter when we go from indoors to outdoors and vice versa. The accommodation for people with trifocals or bifocals, you need to slow down and give your eyes time to adjust. That is so important because it's so easy to trip over things you can't see. If I were to give one big piece of advice, it's really to slow down and concentrate. And I have had to learn that falling up that one stair, even though it was only one stair, it was a reminder to me. And, sometimes when you get a reminder, it's helpful.
Yeah, that is a very, very important takeaway, Marguerite. And you know, we've talked a lot about older adults and their risk for falls, and I'm just wondering, perhaps Emily or Chris, maybe you have some thoughts on, you know, a lot of the recommendations have been focused on older adults, but what advice do you have for younger adults to avoid the concern of falling as they age? Are there any tips that you have from your perspectives that all of us could be mindful of?
You know, it's true. Anyone at any age can fall, and Margarita, it's interesting your experience of falling at one step. I myself actually fell about a month ago at Davisville subway station. I was in a rush trying to get my bus, and one foot kind of just tripped. And so I think your advice about slowing down and really kind of concentrating and being mindful of where you are, I don't think that's solely applicable to older aging adults. I think that's applicable to everyone, no matter what situation you're in. I think it's common to see people on their phones, especially sort of younger individuals. So I would say, you know, be aware of your surroundings. Don't be on your phone, and really slow down, especially if you are going on stairs or if the weather is changing and it's slippery. I think, you know, we focus a lot on older adults, but there are so many things that are applicable to everyone, regardless of age.
That's great. Thank you. And I mean, you've all shared such a nice array of both descriptions of risk factors, but also tips and strategies. And before we finish off the webinar, I just wanted to go around the table one more time and just, you know, get you to think, is there sort of one very easy tip that you can share that someone, like an easy takeaway that we should all take with us after listening to this webinar, something we might think about differently or do differently as we approach the rest of our day. Chris, do you have a quick tip for us?
Sure. I think the common theme that everyone has shared is that, you know, falls are multifactorial, but I'll focus in on medications. The easiest thing that one can do is having an up-to-date medication list, and then asking your healthcare providers, like, what are some of my risk factors for falls from my medications? Can they be adjusted? That would be my important tip.
Great. So I've heard, you know, the medication reminders. I've heard slow down, both from Emily and Marguerite. Nadine, any final, you know, tips or takeaways that you wanted to share?
So as an OT, I would say falls happen and they're really unfortunate. They can cause injuries, but the good news is that they can be prevented. And one of my key role is to prevent falls or prevent future falls. So what I would say is to just consider your environment and what is around you and look at ways in which you can make it safer for your home. And I would reiterate that you are the expert in yourselves, and to be very aware of how you're feeling and to seek support. There are resources out there to prevent falls and to avoid falls.
Wonderful. Thanks so much. Such a great array of thoughts and lots of food for thought for us to take away with us today. I wanted to highlight a little competition that we're having for Fall Prevention Month at Sunnybrook. And we at Sunnybrook have asked everyone to fill in a little quiz, their knowledge around fall prevention, and with the chance of winning a prize. And quite graciously, our team has offered to extend this to the members of this webinar as well. So we're going to put there it is. There's our quiz. It's on the slides. If you would like to take this quiz, you're very welcome to. And who knows, you might even win a gift card prize. So thank you, everyone. I'm going to hand it back over to Brandy to help wrap us up.
Wonderful. And just before we do our wrap up, we did have a couple of additional questions that have come in. So while we've got the panelists still up, if we could, the first question is, are there any tips to help someone gain confidence after they've already fallen? If somebody wants to, yes.
Anyone want to take a stab at that one? Maybe Emily, do you want to start?
Yeah, I would say I think that's a really good question, and certainly after having a fall, it's not uncommon to be afraid of falling again. And then, you know, it becomes a bit of a cycle where you are at increased risk for fall. So, you know, I would say try to do what you can to sort of decrease those risks, whether it's looking again at your environment. You know, maybe you fell because one of your legs was a bit weak or you were feeling shaky. See if maybe you can work on your balance. Maybe you see a physiotherapist, or you have an OT come into your home and do a home safety assessment. But I would say the important thing is to keep moving forward, keep trying to be active and keeping moving, because if you stop moving out of fear, you are going to get weaker, your balance will decrease, right? So you want to sort of prevent that, and you don't want to get into this sort of negative cycle. So see what factors or what things you can change, whether it's in yourself or your environment. But I would say don't let it stop you, from being active again.
That's a great tip. And Marguerite, you've had firsthand experience with this. Do you have any tips to share to help gain that confidence back after a fall?
It's not the fall that does you in so much, it's the injury from the fall. And that's what you really want to avoid. And I think Emily has it correct there, that if you build up that muscle strength and just that more in general, high energy with good nutrition and good exercise, you build up confidence. But I also wanted to add, because Chris pointed out how multifactorial fall risks are, and that is totally correct. So I would strongly suggest going to every resource you can find. And we do have quite a number of resources at the end of the presentation here. And right now, Fall Prevention Month it has been updated with some resources for seniors and their caregivers. So please go there, learn everything you can, because this is your life, your independence, and you want to have fun. You want to party, you know, not be frail and not enjoying life.
That's great. I love your positive attitude there, Marguerite. And I'm just noticing another question that came in. So who do you call if your loved one falls and cannot get up? And I know there was some reference earlier to those alarm systems that, you know, you can get for your loved ones so that they can press a button if they need to, and help can be on the way. And so I don't know, does anyone else want to describe what their advice would be in those moments? If you didn't have access to an alarm system, who should you be calling if your loved one has fallen and cannot get up? Nadine, do you want to take that one?
Yes. So I'll explain a little bit how Lifeline works. So when someone has a fall and it's detected or they press the button, it automatically gets connected to EMS. So with falls, as Marguerite mentioned, there are injuries, and you want to make sure that it's something that needs to be addressed. So I would recommend calling 911 if you have had a fall, to ensure that it's whether you need to be taken to the emergency department or if you just need the help getting up. So my recommendation would be 911.
Great. And I think we're almost out of time. I'm just going to maybe very quickly respond to one more question. It says, how do you help an older adult transition to penguin walking in the winter when you are already helping them with proper walking gait? This is a question from a registered kinesiologist. So maybe Marguerite, did you want to respond in terms of the penguin walking, or Emily, do you want to mention anything about gait?
If I were to practice penguin walking, I would want to do that in the house. I wouldn't want to start out where it's already icy and I'm at risk. And you know, just encourage people. You know, I know you can learn this. Let's practice here.
Great. Okay. Well, thank you so much. I'm going to pass it back to Brandy. I think we've gotten through all the questions that came through.
Perfect. Yes, thank you so much, everyone. I've learned so much today myself. I will be booking somebody to install railings at my front door immediately. So there's a good outcome already. We're happy to share these resources here on the next couple of slides, but we will already, as I've committed to earlier, share those with you in an email. And we're just at time now. So I want to thank all of our panelists, Siobhan as well, for facilitating just a great discussion today. Marguerite for a wonderful presentation before that. And thank you all for joining us, taking the time today to join us. And we will send all of you an email with a link to the recorded webinar as well as the list of resources. And so on behalf of the Sunnybrook Fall Prevention Committee and the Center for Injury Prevention, Loop, and all of the other organizations that are represented in the work that our panelists do, we want to wish you a safe and healthy holiday and winter season ahead, and all the best for a great afternoon. Thank you again for joining us.